We're here today because we had a vision for this vacant lot, a vision for a healthier Newark, for expanded St. James, and a brighter future for everyone who calls the West Ward home. And today we're on our way to realizing that vision, having secured $1.4 million in federal funding for St. James to expand its community health center to the West Ward of Newark. Now, before we talk a little bit more about that, I want to take the moment to say a few words about Justice Kennedy's retirement from the Supreme Court and what it means for the health and well-being of every family across America. Already the Trump administration has put the protection that I fought for when I helped work with President Obama to create the Affordable Care Act, the protection for pre-existing conditions that we fought so hard for in the Affordable Care Act on thin ice by refusing to defend it in a Texas court. Not just refusing to defend those protections, but arguing that they should be overturned. This position jeopardizes protections for nearly 52 million Americans who have a pre-existing condition across this country. And right here in New Jersey, 3.8 million of our 9 million citizens have a pre-existing condition. A child born at birth with a birth defect, a husband who had a heart attack, a woman who might have had cervical cancer, all pre-existing conditions that before insurance companies could deny them coverage or charge them exorbitant rates just because of that condition. We eliminated that discrimination in the Affordable Care Act. It's critical to so many people in our state and in our country. These are cancer survivors, children born with generic disorders. They're workers who struggle with diabetes and chronic pain. They're women who dealt with complicated pregnancies. They are every patient who walks through the doors of a community health center like St. James. And remember, insurance companies decide what a pre-existing condition is. That means any one of us is a denial away from huge medical bills. It's no exaggeration to say that protections for pre-existing conditions form the very heart of the Affordable Care Act law. And now we face the terrifying prospect of President Trump appointing another extremist justice who will drive a stake right to the heart of it. Senate Republicans already stole a Supreme Court seat by refusing to consider President Obama's nominee. And there's a real possibility they're going to rubber stamp any right-wing judge put before them. That's why I believe this battle won't be won in the halls of Congress. It will be won by everyday Americans rising up and speaking up for their rights, the rights of women to their own reproductive health choices, the rights of children born with birth defects or chronic asthma to get covered, the right of every American to affordable health care. That's what the battle is over this Supreme Court nomination, and we need to raise our voices to make sure that we don't end up with a right-wing judge that will determine for a generation what the court will be. Now, that's a mission of helping people that's provided here at St. James Health. This $1.4 million grant is about more than a building. It's about opening the doors to affordable health care to this community. This isn't the first time that we've gone to bat for St. James. Back in 2015, Senator Booker and I led a charge to secure St. James funding so that they could build their first health care center on Newark's east side in the Ironbound. They got their site up and running in just 120 days. And ever since then, more and more New Jerseyans have looked to St. James for care that they can count on. In fact, during the first 6 months of this year, of 2018, St. James served more patients than they did in all of 2017. Now this new grant will help St. James build a bridge from east to west. And that's good news, because right now we know there aren't many primary care providers in this neighborhood. As a result, many folks head to the Beth Israel ER emergency room whenever they need care. That's not sustainable for anyone. We know that when people have to rely on emergency rooms just to see a doctor, it's stressful, it's expensive, and it drives up the cost for everyone. That's why federal investments in community health centers are so vital. For communities of color and low-income families, it means access to everything from pediatric checkups to prenatal care to mental health services close to home. It means accessing preventative care so you can avoid another trip to the emergency room. I've always believed that community health centers are a key piece of the puzzle that's making healthcare affordable in this country. That's why back in 2010, I authored the provision in the Affordable Care Act to level the playing field for community health centers and to pay them fairly. And during the same debate, I fought to include a dramatic expansion of federal support for community health centers to the tune of $11 billion. But make no mistake, upholding this commitment is no easy feat in today's partisan environment. Throughout 2017, many health centers dealt with tremendous uncertainty as Republicans in Washington played political games with their funding. Fortunately, we Democrats stood firm, and we're proud to have led efforts in the Senate to secure $7.8 billion in funding for fiscal years 2018 and 2019 in the Budget Act, as well as $1.6 billion in the recent omnibus package. It's because of our work that we were able to stand up for health centers like St. James and all of those across New Jersey that are helping average New Jerseyans every day. So let me close by saying we may have won this battle, but we're fighting a larger war being waged by the Trump administration against affordable health care. Under this president's watch, corporations are swimming in trillion-dollar tax cuts while working families are drowning in higher premiums, higher deductibles, and higher prescription drug costs. It's absolutely unacceptable, and the crisis is only to get worse if the president takes us back to a day when insurance companies denied coverage to patients with pre-existing conditions. That's why I said the battle for health care as a human right isn't going to simply be won in the Congress. It's going to be won in our towns and in our cities. It's going to be won by ordinary Americans rising up and demanding better. That's how we stopped the Republicans from repealing the Affordable Care Act last year and ending Medicaid as we know it. It's how we protected coverage for 800,000 New Jerseyans. It's how we protected community health care centers in the budget. It's how we're going to stop Donald Trump from taking us backward in 2018.